Mr. Speaker, the Ministry of Health continues to make notable strides against the fight against HIV and AIDS. According to the Eswatini HIV Incidence Measurement Survey, what we refer to as SHIMS-3,
SHIMS-3 stands for the Swaziland HIV Incidence Measurement Survey, and I'm assuming this is the third time the US organizations funding this study have carried it out in Eswatini. The work of counting, calculating, and computing the spread of HIV infection in our country as Eswatini is funded and administered by a diplomatic or foreign power, the USA, through its local embassy and affiliated organizations like the President's Emergency Plan for AIDS Relief, or PEPFAR, and the Centers for Disease Control, the CDCs. Towards the end of this excerpt from the recent national budget speech by Eswatini's finance minister, you will hear how the USA intends to increase the numbers of Eswatini who permanently consume HIV drugs, especially pregnant women.
In 2021, the Ministry of Health reduced the HIV incidence, in other words, new HIV cases, from 1.4% in 2016-17 to 0.62%, and made significant progress towards the UNAIDS 95-95-95 targets set for 2025.
This 0.62% decline in new infections was documented in 2021, and so this blood testing and tracking of Eswatini who allegedly consented to the study was taking place throughout a period of 4 years. We are told here that 1.4% of the approximately 200,000 known cases of HIV infection among Eswatini's 1.2 million people was the ratio of new infections in 2016-2017 to the population of documented cases, and that this ratio had decreased by 0.8% in 2021. 200,000 Eswatini is the minimum number of our people who are documented by the AIDS Healthcare Foundation, or AHF, as permanent consumers of the HIV drugs prescribed and enforced by these US organizations by means of Eswatini's health ministry. AHF is headquartered in Los Angeles and was pioneered by the French discoverer of HIV, virologist Luc Montagnier, and general practitioner David Ho, a Taiwanese immigrant doctor who was treating the first AIDS cases to occur in LA in the late 70s.
SHIMS-3 reveals that in Eswatini, 94% of adults 15 years and older living with HIV are aware of their status. 97% of those aware of their status are on antiretroviral therapy, what referred to ART, and 96% of those on ART have achieved viral suppression. Government is planning to enroll even more HIV-positive patients onto ART by at least 1,974 patients by March 2024. This means that targeted HIV-positive people on ART will be increased from 204,483 in September 2022 to 206,457 in March 2024. The targeted HIV pregnant women on ART will be increased to 98% by March 2024, whilst TB success rate will be increased from 84% in September 2022 to 90% in March 2024.
Lolu phenyo i-SHIMS-3 lolu hlelo lwenyuvesi yaseMelika i-Columbia University lolukhicitwa linxusa lakhona i-ICAP kuleli. ICAP umele International Center for AIDS Care and Treatment Programs, lokuchaza ukuthi hulumende wemamelika watinika ligunya yena lokuthi kube nguye lowengamela konke lokuliphenyo noma ke licwaningo lokuphathelene neligciwane i-HIV. Emhlabeni wonke jikelele kuthatha ndiphethe simaSwati kanibe kushona mangabe kuhlela nekwenta kwetfu kusalawulwa ngilelinye live letetfu tindzawo tekufundzela i-UNESCO, i-Christian University of Eswatini, i-ECOT lebekuyi-Scott, neminyango yetelicwaningo njenge-Department of Statistics, nema-Royal Science and Technology Parks lakhiwe ngemthelo weMaswati, tehluleka tonke letinhlangotsi kutsi tikhicite yeMaswati imiphumela nelwati mayelana nesimo se-HIV kuleli. Kuphela kwencindzetelo yetfu sibamfu labamnyama kuleli vekati kubonakala ngekuthi loluhlanga lwetfu lolugcilatekile lubese liyatisukumela lutibambele imisebenti yekunakekela buve nekuphepha kwetfu sibamfu labansundu Eswatini. Quand notre roi a exprimé ce que nous souhaitions pour notre participation dans la gouvernance globale, il rappelait aux Nations Unies qu'aucun pays a le droit d'intimider ou saper un autre. Le roi parlait en sujet de la menace de bombes nucléaires, mais il y a besoin d'illuminer que la capture d'un État par un autre est une menace comme grave et dangereuse que les armes nucléaires. Parce que quel genre de vie est ce pour Eswatini, sans la liberté d'avancer nos propres intérêts, en raison d'une puissance étrangère? C'est vrai que c'est un scientiste français qui a découvert le VIH et c'est un virologiste américain qui a créé le test sanguin pour le diagnostiquer. Cependant, nous avons le droit, comme nation souveraine d'Eswatini, d'examiner et adapter les données des agences de l'étranger en toute indépendance avant que nous les appliquions. Nous avons le droit de formuler nos propres renseignements et stratégies en créant un programme anti-VIH à l'abri du racisme et du génocide pour Eswatini. En effet, c'était Luc Montagnier, Robert Gallo et Dr. David Ho qui ont créé la stratégie actuelle pour traiter le VIH, mais il faut que ce soit les natifs d'Eswatini qui formulent la réponse d'Eswatini à toute menace, pas le gouvernement de France ou les États-Unis d'Amérique. Frankly, 95-95-95 is political jargon for biochemical genocide, because to push ahead with such aggressive quotas for actual humans who, according to international human rights law, have agency over their bodies and health, to push ahead with procuring the number of Swati blacks, humans, that the US Embassy wants on ART, shamelessly targeting pregnant women and therefore black babies while they're still in the womb with highly toxic and strenuous pharmaceutics, is what is known as genocide. It is biochemical genocide. It is the racially motivated targeting of Eswatini's black population to weaken our health and shorten our lifespan. It is biochemical warfare. Since the first rollout of the National HIV Program in the early 2000s, there remains the glaring need to prevent and manage ART side effects more conscientiously among its local users. We all know that our relatives and friends are struggling with ART adherence because extreme drug hypersensitivity or allergic reactions indicates that the body is screaming and threatening to shut down from these chemicals originally designed to kill cancer and then emptied into a different so-called healthcare program that now sees racist American politicians pretending to eliminate a genetic condition they're actually propagating aggressively in the name of preventive antiretroviral therapy, ART. At the close of this political term, Reichenberg's ministry proves that his administration too has neglected to factor our protection from this proven danger, from ART drug hypersensitivity, which kills up to 13% of specific gene pools that ARV drugs were tested on, such as the Maasai of Kenya. In the USA, patients may opt out of ART, but in Eswatini, Tengetile Dlamini, was kept in psychiatric detention for 3 months for the specific reason of refusing ART because she had been living healthily with HIV for 8 years until the USA pressured SADC heads of state to force ART on just the black citizens. Because when do you ever find whites, Indians, and East Asians being stalked by these California headquartered NGOs to ensure that they know their HIV status and are adhering to ART? When? Or, as I've been highlighting since 2015, is HIV now the blacks' disease, since they stopped calling it gay-related immune disease or GRID in 1982? How long will you citizens keep looking on like it's none of your business as our race is being wiped out to make way for racial groups considered more deserving of Eswatini than ourselves? In 2015, there was just one CD4 count machine servicing an entire prevalence chart-topping Eswatini. That's the reason the FLAS nurse gave one of my friends when she tested positive, but was told that the CD4 counting machine was floating around in a different part of the country, and the nurse didn't know when it was going to find its way back to Mbabane. Why are CD4 count machines not in the budget for the HIV program? If this theory that immediate ART initiation prevents CD4 decline is true, who do Minister Lizinkosi, Minister Princess Sikanyiso, and Minister Rakenberg think they're fooling? They're choosing the millions of dollars they receive as a reward for arbitrarily signing over our public health ministry to a program of genocide. Gilead Sciences grossed $3 billion in 2018 when Princess Sikanyiso used her seat in the Senate and the ICT ministry to set up a nationwide network of clinics to distribute Gilead Sciences' so-called HIV prevention drug Truvada. How long are you citizens going to keep silent while these murderous politicians line their pockets at the expense of our black lives?